What if I told you that your body might already be warning you about a heart problem, but you're ignoring it, thinking it's just normal aging? Most people over 50 miss these early signs until one day it's too late. And the scary part? Some of these signs seem so small that you wouldn't even think twice about them. Stay with me, because today I'm going to reveal 7 warning signs of heart problems that you should never ignore after 50. One of them might surprise you the most. In this video, you'll discover the subtle symptoms your body gives weeks or even months before a serious heart issue. Why many people mistake these signs for simple fatigue or aging, and most importantly, what you can do right now to protect yourself. Doctors often say, the heart whispers before it screams. The question is, are you listening? Let's begin. 1. Unusual fatigue that doesn't go away. Let me ask you something. Have you ever felt tired, even after doing almost nothing? Not the normal kind of tired, but a deep, unusual exhaustion. That could be your first warning sign. What's happening? As we age, our heart has to work harder to pump blood. If there's a blockage or weakness, your body doesn't get enough oxygen, and that leads to constant fatigue. Real-life example. A 58-year-old man thought he was just getting old. He started feeling tired while walking short distances. He ignored it. 2 weeks later, he had a mild heart attack. Why it's dangerous? This type of fatigue is often dismissed. But doctors often warn that persistent fatigue can be an early sign of heart trouble. What you should do: pay attention to sudden changes in energy. If simple tasks feel exhausting, don't ignore it. Get a checkup, especially if it lasts more than a few days. Tell me in the comments, have you ever felt unexplained fatigue recently? Because what I'm about to share next is something many people completely overlook. 2. Shortness of breath, even without exercise. Here's something most people think is normal: feeling breathless after climbing stairs. But what if you feel breathless even while sitting? Why it happens? When your heart struggles to pump blood, fluid can build up in your lungs, and that makes breathing difficult. Scenario: imagine sitting on your bed, doing nothing, and suddenly feeling like you need more air. That's not normal. Important: many experts agree. Shortness of breath is one of the most common early signs of heart disease. Red flags: breathlessness at rest, difficulty lying flat without feeling suffocated, waking up at night gasping for air. What to do? Don't ignore recurring breathlessness. Consult a doctor immediately. Track when it happens. Quick question: do you ever feel like you can't get enough air even without activity? Stay with me, because the next sign is something people often confuse with a stomach problem. 3. Chest discomfort, not always pain. When people hear heart problem, they imagine sharp chest pain. But here's the truth: it's not always pain. Sometimes it's just discomfort, what it feels like: pressure, tightness, burning sensation, fullness in the chest. Real story. A woman in her early 60s thought she had acidity. She felt a mild burning sensation in her chest. She ignored it. Later, it turned out to be a warning sign of a heart attack. Important fact: doctors often say heart-related chest discomfort can be subtle and misleading. Warning signs: discomfort that comes and goes. Feeling of heaviness in chest pain, spreading to arms, neck, or jaw. What to do? Never assume it's just gas or acidity. Get medical help if it repeats. Better safe than sorry Be honest. Have you ever ignored chest discomfort thinking it was nothing? Now, here's something even more surprising. But what most people don't realize is this. Some of the most dangerous heart warning signs don't even happen in your chest. They show up in completely different parts of your body. And the next one is one of the most ignored signs of all. 4. Pain in the arms, back, or jaw. This might shock you. Heart problems don't always cause chest pain. Sometimes, the pain appears in arms, especially left arm, back, neck, jaw. Why it happens? Your heart shares nerve pathways with other parts of your body. So the brain gets confused and sends pain signals elsewhere. Scenario: you wake up with a dull ache in your jaw or pain in your shoulder. You think it's just muscle strain, but it could be your heart signaling distress. Experts say radiating pain is a classic but often ignored symptom of heart issues. Watch out for pain without injury, pain that comes with fatigue or breathlessness, sudden unexplained discomfort. What to do? Don't ignore unusual pain patterns, combine symptoms, higher risk. Seek medical advice quickly. Have you ever had unexplained pain like this? Because the next sign can literally happen while you're resting. 5. Irregular heartbeat or palpitations. Have you ever felt your heart suddenly racing, skipping beats, fluttering? That's called palpitations. What's happening? Your heart rhythm may be irregular, which can signal underlying heart issues. Example: a 55-year-old noticed occasional fluttering in his chest. He ignored it for months. Later, he was diagnosed with an arrhythmia. Important: not all palpitations are dangerous, but frequent or sudden changes should never be ignored. Warning signs: heart beating too fast or too slow, dizziness along with palpitations, feeling faint. What to do? Monitor frequency, reduce caffeine and stress, get ECG if needed. Quick check: have you ever felt your heart beating strangely? Because the next sign is something many people think is completely unrelated. 6. Swelling in legs, ankles, or feet. This one surprises most people. Swelling in your legs can be linked to your heart. Why it happens? When the heart isn't pumping properly, fluid builds up in the body, especially in lower areas due to gravity. Scenario: your shoes feel tighter by evening. Your ankles look swollen. You think it's just water retention, but it could be something more serious. Experts warn persistent swelling may indicate heart failure or circulation issues. Signs to watch: swelling that doesn't go away, tight skin or shiny appearance, weight gain due to fluid. What to do? Elevate legs, reduce salt intake. Consult doctor if persistent. Tell me honestly, have you noticed swelling in your feet recently? Because the next sign can happen while you're sleeping. 7. Sudden dizziness or fainting. Imagine this. You stand up and suddenly feel dizzy, or worse, you faint. Why it happens? Your brain isn't getting enough blood flow. And that often links back to the heart. Real situation. Many people ignore dizziness thinking it's weakness. But repeated episodes can signal serious heart rhythm issues. Doctors often warn that fainting can be a major red flag for heart problems. Watch for sudden dizziness, loss of balance, blackouts. What to do? Sit down immediately, stay hydrated, seek medical evaluation. Have you ever experienced sudden dizziness? Because now, let's connect everything you've learned. Let's quickly go over the 7 warning signs. Unusual fatigue, shortness of breath, chest discomfort, pain in arms, back, or jaw, irregular heartbeat, swelling in legs or feet, dizziness or fainting. These are not just random symptoms. They are your body's way of saying, something is wrong. And the earlier you listen, the better your chances of staying healthy. Your heart has been working for you every second of your life. Now it's your turn to take care of it. Don't ignore the signs. Don't delay. Because sometimes a small symptom today can prevent a big problem tomorrow. If you found this video helpful, like this video, comment below which sign surprised you the most. Share this with someone you care about. And don't forget to subscribe, because your health matters more than anything.